Hello, my name is Matt Strelo, and this is the second part of our How to Systematically Evaluate ECGs. And in this section, we're going to focus on determining the rate. So let's get started. So in our systematic approach, rate is the first part of that. And the best way to start, we're going to talk both about ECGs and on rhythm strips. In both cases, we typically use a paper speed of 25 millimeters per second. So it's important to know what your paper speed is when talking about an ECG or a rhythm strip and determining the rate. If you're using the standard paper speed of 25 millimeters per second, then you'll see these different boxes. And on these boxes, you'll be able to see a big box and these little small boxes. The big box stands for 0.2 seconds in time. And the small box then, there's 5 of those in a big box, then stands for 0.04 seconds in time. And so when we're determining the heart rate on a rhythm strip, we're handed a rhythm strip, and a rhythm strip typically is 6 seconds. So if we want to determine the heart rate, then we would count up all the QRS complexes, okay? And in this, over a 6-second period, or our rhythm strip time period, you're going to take that 5 QRS complexes here, you're going to multiply that times 10 to get 60 seconds, and you're going to have 50 beats per minute. I use the term beats per minute, but in actuality what we're talking about is QRS complexes per minute. On an ECG, in contrast to a rhythm strip, we generally have 10 seconds. And so we have a 10-second period of time that we're looking at. And in this case, we count up the QRS complexes. There's 15 QRS complexes. We multiply by 6 to get to 60, and we have a rate of 90 beats or QRS complexes in a 1-minute period. What about this one? Well, if you take the time to count up each beat or QRS complex, you're going to note that there's 33 QRS complexes. You're going to multiply that times 6, and you know that your heart rate or your beats per minute is about 200 beats per minute. Caution though, because it's very important to distinguish electrical activity on a monitor or ECG from the patient actually having a mechanical, palpable pulse that is perfusing their organs. So I've frequently seen providers who are evaluating a very sick patient. They look up and they say, the heart rate is 130 on the monitor, but they never actually check a pulse. And what they find then is that the patient is actually pulseless and in pulseless electrical activity. So remember that when you're looking at a monitor or an ECG, you're looking at the electrical activity of the heart, but not necessarily the mechanical functioning of the heart. So always confirm whatever heart rate you see on a monitor or ECG with the patient's pulse at the bedside. Another way to evaluate the patient's heart rate on a rhythm strip or ECG is to use the rule of 300s. And this works when you have that 25 millimeters per second paper speed. And what you do in the rule of 300 is you count the number of big boxes between QRS complexes. And in this example, there's 6 big boxes. So you take 300, divide it by the number of big boxes, and that gives you the heart rate. So 300 divided by 6 is 50. So a good estimate of this patient's heart rate or QRS complexes per minute would be 50. What is the heart rate here? Well, we can count about 4 big boxes between QRS complexes. We take 300, we divide that by about 4, and we get a rate of about 75 beats per minute. Remember, though, that the rule of 300s only works in regular rhythms where the QRS complexes are coming at regular intervals. In an irregular rhythm, where the QRS complexes are abnormally spaced, some are close together, some are far apart, the rule of 300s cannot be used. So here is an ECG. Take a look at it and determine what the heart rate is. Remember, we're trying to evaluate the entire ECG in 30 seconds to 2 minutes, so you don't really have a lot of time. The fastest way to determine the heart rate is to look up in the corner, because most ECG machines present or show an accurate heart rate. They just count the machine just counts the QRS complexes and multiplies it times 6, like we talked about. This is also true on a monitor, where the monitor will show, or a rhythm strip will show, the heart rate and will be accurate the vast majority of the time. The question then is, when is it not accurate? Okay, and so you have to be careful, because the times that you'll see an inaccurate reading on either an ECG or a monitor about the heart rate is when it is detecting the T wave as a QRS complex as well. So when you have a tall, peaked T wave, it can look like a QRS complex. And the computer then can read the tall QRS complex and the T wave and say, okay, and it will show a heart rate that is twice the patient's actual heart rate. So be careful in situations where the rate looks very fast and the T waves are large or very tall, and you want to confirm the electrical rate that's reading on the monitor ECG with the patient's pulse again. So in summary, determining heart rate, count the number of QRS complexes and multiply by 6 for a 10-second or standard ECG. The machine rate, though, is correct in most circumstances, and so just glancing at that and confirming that it looks approximately right is adequate, unless the patient has tall T waves and you think it might be doubling the rate on the machine reading. Thanks.